or good afternoon. My name is J.C. Park, the periodontist, and I'm the director of the Yonsei Good Day Dental Clinic. I'll be the operator and the moderator of today's case. It is my great pleasure to be back onto this Dentium live surgery, which is lively broadcasted. If you have any questions, please go to the website and there's a comment link. Please leave your question directly and I'm going to check it and I'm trying to, as soon as possible, to feed back to you. So today's case is a full mouth bright implant placement after immediate extraction, and I'm going to use the DASK drill and the Dentium Regeneration Materials. So I have mixed a lot of surgical techniques to each site, and you will enjoy what technique that I'm going to use. It will be a very great thing to see. This is the patient information. The patient was a 50-year-old male, and he had all the teeth very loose, and he said it hurts when I bite down. So he had a complaint about how to eat and to properly chew. And he was very healthy. Actually, he was a very strong man, working really, really hard, but he was too busy to visit the dental clinic. So he had to extract all of his teeth. Today's surgery plan, this is the pre-op panoramic view. As you can see, many of the teeth are very mobile, and he had a very severe vertical bone loss, anterior and also the posterior areas. So today I'm going to extract all of his teeth, and I'm going to use especially the Bright Tissue Level Implant. Bright implant is a brand new implant from the Dentium implant. It used to be Implantium or Superline lines, but now we have a new Bright level, and Bright implant has two lines, bone level and the tissue level. Today I'm going to use the tissue level implants and place 7 implants on the maxilla and 6 implants in the mandible, which will be immediately restored. So watch how I perform the surgery and the restorative processes. And the bone and soft tissue grafting will be performed using all the biomaterials coming from the Dentium, Osteon Genocollagen, Osteon 3 collagen, collagen graft 2, which is known as a X1D, and recently a new product has been produced, X2D, which is actually a new line of a collagen graft. And also I used the collagen membrane 2 coming from the Dentium. So I hope that you will see many biomaterials coming from the Dentium, and I hope you enjoy the surgery. So this is the Beam City images of the sagittal and coronal view. You can see that many bone has been lost in vertically and horizontally. This is as out facial status. You can see that his anterior teeth has came out of the socket and it's very loose and it's losing the vertical dimension. And also he's not a good brusher, as you can see. You can see many dental plaque and calculus are present around all of his teeth, and his gum is quite swollen severely, which means that inflammation and the granulation tissue will be present, which can be a little bit difficult to manipulate the soft tissue. As you can see, the healed socket has a very strong and thick and firm soft tissue. Meanwhile, in this patient Kim's gum, swollen, very fragile. Even immediately after touch, it's going to bleed, and it's going to bleed severely. So it will block my view. It will make my surgery very difficult. So you can enjoy how I overcome that difficulty. The implant system that I'm going to use is a Bright implant, which I've mentioned before. And especially the Bright implant has 2 levels, which is a tissue level, which is very similar to the original Straumann ITI implant, which has a smooth surface neck above the rough surface. Straumann has a 1.8 millimeter or 2.8 millimeter smooth neck, but Bright tissue level implant has a 1.5 millimeter height neck, and very interestingly, Their platform is all the same from the 2.5 and all the way to the 5.0, which is a 3.8, same platform. So if you have a comfort cap, which is actually the healing abutment, you can enjoy to have the only one diameter of the comfort cap. And if you have a component, every diameter of the components will be exactly the same. So it's not complicated, and all the procedure is quite straightforward and easy to do. So this is the beauty of the tissue neck implant. And also, it is very thin and very narrow, but it's really, really strong. Working with the cold working and the manipulation of the titanium, the strength, the yield of the titanium material has substantially increased from the previous version. So even though it's very narrow, it is really, really strong. So right now, you can actually change the old concept, placing a very thick and firm implants onto the molar area. Right now, the Dentium is aiming to place only 3.5 millimeter onto the molar area, which might sound very crazy, but it is happening right now. It is changing the field of the dentistry using the Bright implants. It has a 20-degree external taper type. So on top of the smooth surface, it is just like the external hex implant. So we have all the And the biomaterials that I'm going to use are very various. I'm going to use the osteon geno, osteon 3 collagen, and all this bone is coming from the dentium, especially osteon geno collagen, which is a bovine bone coming from the cow. It has a very strong bone quality, which is really good for the volume maintenance. But at the same time, this bone has a very high ossification ability, which means that it can make faster bone healing. As we all know, bovine bone is quite slow, but this bone is fast, but also maintains its good volume. And also because it's collagenated, if you soak it into the saline or PDRN, which is a DNA fragment coming from the salmon, which might further increase the regeneration potential. So if you soak it in this kind of a liquid, it is moldable. You can tear it down, you can shape it, and you can just squeeze it. So very fast, very easy to handle. So these users these days really, really love this biomaterial, which is called osteon xenocollagen. On top of the bone, we have to cover with the collagen. We used to use the collagen membrane too, which is a cross-linked membrane, but these days we use this 3D matrix, which is a volume stable collagen matrix. Volume stable collagen matrix allows us to have the open healing. At the same time, it lets the blood supply go really, really fast. So it's going to heal by the keratinized tissue. It's coming from the porcine. It is good for the soft tissue regeneration, and we can all enjoy the open healing technique. I've been using this material more than 5 years, and it's my favorite material, but recently there was an upgrade. The density of the collagen has been substantially increased from the Dentium's unique technology. It's more dense, it's more powerful, it's really strong against the open healing. So you can enjoy the open healing much more when you do the GBL, when you do the soft tissue regeneration, you can easily use this biomaterial. Right now, the registration from the government is only available in Korea and a few countries, but please wait. You will be able to enjoy these wonderful biomaterials. We have a very similar case from the case that I'm going to show you today from the live surgery. This is another full mouth, nearly full mouth bright implant installation, which is an immediate implantation. In this case, I used a bright implant, but it was a bone level bright implant. So this is the before the extraction. And right after the extraction, I did a immediate implantation. And as you can see, I did a sinus bone augmentation, which is actually osteon 3 collagen particles. You can see that the very rough particles within the socket, the sinus, which is the typical shape of the osteon sinus material, which will be later become a very hard and strong bone. After this surgery, I take a panoramic view to evaluate the locations and then place the bright bone level implants, and then again took another X-ray. And then finally, I go for the immediate restoration as always I do. And after 3 more months, now we have a final restoration. This is the bright bone level implant. As you can see, the implants are very stable. Marginal bone reaction is wonderful. And also the sinus bone shows a great and powerful bone densification. So this biomaterial and this implant, which is I'm going to use today, and this is the surgery that we're going to watch. So let's watch the surgical video. So like I mentioned before, if you have any question, please go to the website. And when you watch this website, you will be able to ask me any question from the comment link. Right now, I do not see the question yet, but anyhow, you can ask me anything. So I'm starting to extract the teeth right now. Like I mentioned before, the patient has a severe inflammation, which has a granulation tissue and a lot of blood supplies. So during the surgery, we can see that the soft tissue is very fragile, and we can see many bleeding. So it is crucial to do the proper bleeding control. If you can see well, you can do the surgery really well. But if you cannot see well, you cannot do the surgery really well. So the visualization of the surgical side is really, really important. So right now, I'm starting to use the Bright drill system, which is also my favorite drill. The super line for the Implantium drills used to be very thick and very cylinder type, so it was difficult to do the immediate implantation. But the Bright implant both can be used for the bone level and the tissue level implants. They are tapered, which is really good when you do the immediate implantation. Usually drills slip and go away, you lose the sight, but this drill does not make that happen. And also it's stoppered. It has stoppers. So when you do the implant, when you approach the inferior alveolar nerve or some very, very crucial anatomical landmarks, if you damage that, the damage cannot be restored. The patient has to suffer from that trauma. So we have to be really, really safe. But this stopper type Dentium Bright drill let us enjoy and have the really safe implant drilling. So already I finished 2 implant restoration, and somewhere here, the residual ridge of the bone height was not really, really long enough. So at some point, I had to use the DASK kit, which is a DASK crystal drill, which has a 2, 4, 6, and 8 millimeter stopper. So you can carefully reach the sinus floor, and then once you break the wall or the floor, you immediately touch the membrane. But this diamond burr does not tear the membrane, so it's very safe, and you can easily insert the bone. Again, this is the Bright Implant Tissue Level type, which is narrow but very, very powerful. Although it has only 3.8 smooth surface neck, the strength is really, really high because, as you can imagine, the bone level implants inside, they have a thin wall. So it might tear, it might break, but the tissue level implant is a full one single body. So it's very powerful. Right now, I'm removing the rubber tab. I don't know what the name is, but it's kind of a rubbery silicone thing. It's protecting the inner screw surface. Once you remove it and throw them away, you can connect. This is the comfort cap. It has the hex type, and sometimes it does not have a hex type. So when you finish your surgery, if you use the non-hex type, it's easy to connect. But today I'm going to take the immediate impression, so I need to locate it properly to fit the hex type. So I'm spending a little bit of time to properly connect the hex of the external hex and the inside hex of the comfort cap. So I'm rotating it and tilting it and finding a little bit of the right position. So this is what we had to suffer when you use the external hex 10 or 15 years ago. So it's coming back. But once you get the perfect connect, there is no gap of the errors because it's a metal to metal connection. It's a butt joint connection. So it's very accurate when you take the impression. So after surgery, after the immediate implantation, I'm going to do the immediate impression for the immediate loading. So right now, this is the osteum xenocollagen, which is a bovine bone mixed with 10 or 15% porcine collagen. After soaking with a saline or PDLN, I can trim it and I can graft it between the implant and the bone, which is a gap. Or, like you see, I'm grafting on buccal side of the bone, which I'm going to try to protect the further resorption. After extraction, we see many resorption in volume, so I'm kind of counteracting that resorption. This is the collagen graft 3. Actually, it's 3 version, but it's called X2D. Collagen graft X2D, which is a very strong, which is a very thick and very dense, as you can see. It's really, really dense. It's good for the open healing. Once you just let it heal, during the healing period, it will receive the blood supply immediately, and it will provide a platform for the epithelium to climb on top of the collagen graft. Now I am doing the suture, which is called modified Laurel suture, which is my favorite suture once I did the GBL. If you just go to the Google or YouTube, type the modified Laurel suture, you will see how it is done. Some of the videos about how to do that suture is actually my video because it's my favorite video technique. And this is a flap folding suture. You just saw that. It's kind of a fold the buccal flap and press down. By the way, the silk material that I'm using is white, right? It's not common. It's usually black or blue. So do you have any idea what the suture material it is? If you know the answer, go to the website and please leave your guess. So it's a little bit expensive suture, but it's also my favorite suture. So on the upper right corner, it's already done. I finished 3 implants with a Krasel approach. I used the osteum xenocollagen. I used the collagen graft X2D, and then that's it. The surgery is all over. So right now you see that during the extraction, I broke the root. It happens, right? When the bone is really strong, it happens. So what I'm doing is, I pick up the Bright implant drill using the Lindemann drill, and I'm taking out the root. So this is the strength of the Bright implant. Its Lindemann drill is so strong. We had to take out the high-speed burr or straight Fisher burr. No, Bright implants, especially the Lindemann drill, it has a powerful cutting efficiency. So as you can see, even if you have a root rasp inside the bone, you can take it out. So I just removed it, as you can see. And I'm starting the anterior area. Like you see, the bone is actually protruding to the front. So I'm placing the implant a little bit to the front. So we have to expect that eventually this implant prosthesis will have a screw hole looking outside. So we have to tell that to the patient and what to expect. The patient should be ready for how to deal with that. The first tissue level implant was a 4.11 millimeter. The reason that I placed a little bit long implant was because he was a very strong man. He was a muscular, he was working really hard, so his biting force seems to be very strong. So I placed a very long implant to prevent any problem. Now I finished placing the canine implant here. And then again, another tissue level implant. Okay. This is the already premolar area, so it's quite fast, right? Bright tissue level implant is a very small kit. Once you see that, you will be very surprised because drill kit is so small, but it's very concise and it's very essential. It's easy to use and cutting efficiency is so high, so powerful. So using this Bright drill kit, you can continue drill and to place the implant. And again, the DASK drill is coming again from the crest approach. 2 millimeter, 4 millimeter. Did you see that? There was a sudden push, right? So it broke the flow of the sinus. And I'm using the mushroom instrument, go around, detach the membrane a little bit. And this material is not an osteon collagen. This is an osteon 3 collagen. So today I'm using a lot of different biomaterials all mixed in different ways. So you have to brace yourself because you don't know, you can't expect what to come up. So this is an osteon 3 collagen, which I normally use when I do the crestal approach and the lateral approach. Synthetic bone, once inside the sinus, they become a very strong bone and rapid radial opacity increase you can enjoy. So this is the osteon 3 collagen, and as you can see, I reversed the rotation of the drill 50 RPM, which actually pushed the osteon 3 collagen through the osteotomy site and spread it out under the membrane. So this is my own technique. If you have a better way to do that, you can please you can do that way, but it's my technique. I'm using the Scan Comfort Cap, which is a little bit long. Why am I using this very long comfort cap? Because I have to take a direct impression. As you can see, his soft tissue is really, really thick maybe from his chronic inflammation, or maybe he has a thick biotype. But anyway, in order to expose that metal surface, I'm placing a very long comfort cap. Again, this is an osteon 3 collagen. I graft a lot of osteon 3 collagen to counteract the resorption. And this is the X1D, previous collagen graft, which is actually my favorite and my old friend. But now we have a newer friend, X2D, but this is the X1D. You can see rapid blood supply. Compared to X2D, a little bit soft. It has a thickness, it has a density, but when you compare to X2D is a really, really strong and thick and dense. But this previous version, X1D, is a little bit friendly. It lets the blood supply kick in rapidly, and also liquid goes in really fast. So this is the very good way to soak and get ready for the open healing. I've been waiting for the comments, but there is not an answer for that suture material, so I'll give you the answer. This suture material is a PTFE suture, which is once known as a Gore-Tex suture, which is not available in dental field anymore. It is still available at the medical field, but for the dental area, this Gore-Tex suture is not available anymore. So we have another brand makes the same PTFE suture. So I love to use that suture, which is a little bit expensive, but this PTFE suture is very strong against the inflammation. And also it has a certain flexibility. So when you finish your surgeon's nut, when you squeeze the nut, maybe the loop has been very loose, but once you're done with the surgeon's nut, if you keep pushing it, you can tighten, and tighten furthermore. So it's really good to control the soft tissue closer. So you can use it if you want. It's ideal for the very delicate soft tissue management. So already we are doing in the mandible. Everything is happening same day. So it's a very long surgery. The patient is traveled for so far away, and he's a very working really hard at his job. So he could not make any day off from his work. So he had to do it in a one day, and I had to deliver the whole set in a one day, single day. So we are running out of the time. So we have to place implants rapidly, take the impression digitally, and then make a rapid PMMA restoration, and then connect, and then send him back in one single day, which is a very difficult project. So already I finished placing one implant, which is a canine area. And then I'm moving on to the premolar area. Again, this is a Bright Tissue Level Implant, which is a tapered, which is slim and narrow, but it has a very strong and powerful thread for the maximum primary stability. And the tissue level, smooth neck, is a 1.5 millimeter height, 3.8 millimeter wide. Every fixture has the same platform. So abutment, impression coping, everything can be compatible. So it's easy to maintain your stock. So right after placement, and then I'm doing a periosteal relieving incision because I'm going to augment the bone. For here, I'm going to augment again the osteum xenocollagen. This is the osteum xenocollagen. Because this area is an immediate implantation, it has a gap. The osteum xenocollagen goes inside to the gap. And now, as you can see, you can mold it and you can relocate it. If you do not like the position, you can cut it and trim it, and you can relocate it. This is a collagen membrane too. You can see that I made a little cross. If I push down, it goes through the comfort cap. You can tuck it into the lingual, and you can tuck it in on the buccal. So it's a clever way to stabilize the membrane. So if you have a healing, something like that, you can go through the healing abutment and then self-secure the membrane using this comfort cap or healing material, healing abutment. So using the PTFE suture, again, I'm doing a finish up on this surgical site. And as you can see, even after extraction, many minutes has passed, but still he's bleeding. In order to control the bleeding, it's a great idea to give additional injection because many lidocaine has an epinephrine. So if you use the epinephrine, blood vessel will constrict and you can actually see better. So if you have a difficulty look clearly from the bleeding, you may use some additional injections, not for the pain control, but for the bleeding control. So this is maybe the final suture for this site. Okay. Right. Now I'm going for the lower left side. You may ask me why I do not extract the lower anterior teeth. I extracted all the teeth on the mandible, maxilla, but I'm leaving the mandible teeth. Why? Imagine. From the maxilla, there are rugae or hard palate, which can be easily scanned using the digital scanner. So it's good for the immediate restoration, but for the mandible, we do not have a very strong point to take the digital impression. Even before the extraction, because I took all the teeth out, there is no stable landmark to match the before and after. So I'm using this a little bit loose, but I'm using this mandible teeth for the rigid landmark for the scanning. And again, this is the osteogenocollagen. I'm filling up the gap. You see that? I grafted the osteogenocollagen first and then placed the implant. Why? We usually place the implant and fill up the bone, but it was a reverse. Why? Because I wanted to increase the stability. For the immediate extraction, sometimes we cannot achieve the best stability. So in order to maximize the stability, I grafted the bone first to kind of fill up inside the extraction socket, and through the gap between this dense bone graft, I placed the implant. It's not going to be really, really strong, but it at least helps to a little bit to increase the primary stability. So I grafted osteogenocollagen first, and then I placed the implant. Again, already the final implant is going in. Bright Tissue Level Implant. Using the bright drill, every drilling becomes so fast and so easy to do, and we can always achieve our wonderful, excellent primary stability because Dentium implant, especially the super line, but also the bright level implant, bright bone level and tissue level, they have a very strong thread. It will guarantee a good primary stability. Again, I'm doing the gap filling. Because it's an immediate implantation, it will have a gap between the bone and the implant surface. So I'm grafting to fill up that gap. And you can see that the bone is actually exposed. To prevent the slippage and the loss of the bone, this is the remnant of the collagen membrane tube that I use on the lower right corner. So as you can see, I trim it and then I cover on top of that osteogenocollagen. Now everything is over. Now it's time to do the suture. As you can see, this is a hidden X suture. You can Google up what kind of a suture it is. This is ideal for the closure of the soft tissue, but they do not push buccolingual. It's good for the volume maintenance. So it's a very ideal technique that I created, introduced to the dental field, hidden X suture. And again, this is the kind of a crisscross suture. You can see that the suture is going this way and that way around the healing cap, and you can better protect the open wound site. So it will actually block and prevent the loss of the bone and the membrane. So the whole surgery was well done without any problem. And right after surgery, we just waited, and the patient wanted to go to the bathroom and make a phone call, and then he comes back. Now the bleeding is a little bit reduced. Now we take out the digital scanner. There are various kinds of the digital scanner these days, but usually they do a very perfect, wonderful digital scanning with a great accuracy and the precision. So we take the scan from the pre-surgery. We also had a scan for the vertical dimension. So we know the vertical dimension, and now we extract, and we have an implant and we scan again. So we do the 3D overlap, and then we can see the implant location and the soft tissue, and the lab technician can do the design of the teeth. So in this case, we were planning to do the full arch PMMA restoration. So it went really well. It is happening one single day. And for the mandible, it fit in perfectly. For the maxilla, we don't know why. There was a little bit the error. So we had to cut it into the segmentation, and we had to use a super bond resin to make that PMMA restoration stuck together. We finished the occlusion adjustment. After that, he went home. So this is the powerful story of the Bright Tissue Level Implant. And this powerful implant, once done in the immediate cases, it shows a great stability. Once combined with the Dentium biomaterials, it gives a long-term predictability and high survival rate. So in your dental clinic, you can actually don't have to worry about immediate implantation, the difficulty of it, the very difficult process of the immediate restoration. Every worry is reduced thanks to the Dentium. This is a cone beam CT right after surgery. You can see that the implant is well placed inside the bone, and the bone has been well augmented on the buccally and also the crestally to the sinus floor. So you may ask me some questions, and okay, there was a comment. I think it's a H.A.S. Lee, maybe it's a Korean. Thank you for watching this video, and he commented, thank you for the wonderful surgery. I want to thank you. So thank you for leaving a comment. And this is the question that we previously received from the audience, even before this live surgery. I think that you might be asking the same question. Why did I use the tissue level implant for the full mouth case? Well, I could use the bone level implant, right? But the problem is I wanted to do the immediate restoration. For the immediate restoration, we do not have time to make the customized abutment. We had to do the design, you have to do the milling, and we do not have that kind of a time. So in order to reduce that surgical time, we have to do the tissue level implant, which has the same platform, same shape. So we already know how it's going to be placed. So even right after the surgery, when you are done with the digital scanning, already lab technician has that metal link which can be perfectly fit to the tissue level. So you don't have to worry about the customized abutment or anything else. So the reason that I chose the tissue level implant was that. And second reason was, like I mentioned before, he was a strong man. He was a muscular and very heavyweight. So we know that he's going to chew really, really high and tight. So in order to prevent the breakage from the fatigue, I wanted to give the best implant, very strong implant to him, but not by increasing the diameter, but this tissue level implant has a very strong neck without any inner portion, which is a full body titanium, which could be very strong. So that's why the reason number 2 that I chose the Bright Tissue Level. Of course, number 3, Bright Tissue Level implant or bone level implant, which can be really, really properly and fast done in drilling because it fits well with the drill and the fixture shape. It always gives me the great primary stability. So this is the reason that I chose the tissue level implant. I hope it was good for your question. So it was a great moment to share my surgical case with you and the immediate restoration. In the future, I hope to share the final results of the final restoration of my patient in the near future. Thank you for watching, and I want to make a small comment about the next live surgery, which will be on November 7th, also Friday, same time, Korea the Friday night evening, 7 p.m. So if you need any further information, please visit clinicaldentium.com. And I hope you enjoyed the show as much as I did. Thank you very much.